we have Juan in. Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Juan in here with us this afternoon. And Juan was referred in by his dad, who's a patient here already. And Juan comes in this afternoon complaining of low back pain that shoots out into his legs, into his feet, down into the big toe specifically. Numbness and tingling down into the L5 dermatome too, which is down into his big toe. He's got mid-thoracic pain and spasm in here, then also rib pain that radiates out on both sides around into the front. And then he gets neck pain and headaches every day. And he has a lot of cramps and muscle spasms in his spine that wake him up at night, and especially first thing when you wake up in the morning, right? Mm-hmm. Yep. And he's got bilateral rib pain that starts back here in the mid-thoracic and lower thoracic spine, goes around to the front and attaches into his sternum. I've already done his comprehensive history and examination, so this is his very first treatment here today. So you get to see a first-timer. Gets a ring dinger today, so I'm going to decompress him because he is compressed. Okay, so let's have you close your eyes again, Juan, and flex your head forward and backwards. I know you and I've already done this, but we're going to show the YouTube people. Okay, back to neutral. Your head's forward and to the right. You see that? That's how you're sleeping. And then your head's turned to the right too, so that's the way you turn your body most of the time. Your pelvis is shifted over to the left. So let's go ahead and lay you back on your stomach for a moment here, and we'll get you your first adjustment. Now, in checking his leg length, which I do on every patient, his right leg's a half an inch shorter down here. I bring them up, they get even, and that tightens up in his low back and his thighs. That's a positive Knockless and Deerfield test on the right. Okay. So I'm going to start off adjusting his right SI joint. And then his left SI joint, sacrum superior to inferior, and on the Z-axis. Now this probably be a little sore in here, Juan, because it's been out for a while. This L5. Yep. There's L4. I tell you, these are going to be a little tender at first, but they'll feel a lot better when I get them put back in place. There you go. That's it. Okay, breathe. I got you. There you go. Okay, keep breathing. Don't hold your breath on me. Yeah, you locked up in there. You feel that? But, look there, just like magic. It's exactly even. I bet you this feels easier, doesn't it?
Yes, sir.
Uh-huh. Hey, I'm just getting started, man. Put your neck curve back in there for you because you're propping yours up on too big of a pillow or tucking it under your arm. Let's go on your back for me, please, sir. Whew. Tristan's playing hooky on us today.
I know.
There you go, good. Slide down this way just a bit. I think he went out and had too good a time with his football buddies last night. There you go. Put your arms out to the sides, on both sides, please, sir. There we go. So I'm going to adjust both your shoulders, your clavicles, and your interior ribs here. Yes, sir. There you go. Good. You can relax your hands on your tummy now, Juan. Let me have this right leg just go like a limp rag with your right ear. There you go. Should have felt that all the way up to your lower back. From your knee up to your lower back, did you?
Yes, sir.
Okay. Same here. Breathe. There you go. Good. All right. Let's set you up face towards your dad. There you go. We treated a lot of families here. Because usually when one family member feels good, the other family members see that.
Yes.
They want some too. There you go. It's the only place in town you can get beat up, feel better, and pay for it. It's still legal. There you go. Yeah. There you go. Good. Okay. Now let's come over here on this table. All right. We got a clean towel for you here. Didn't look like you're shading makeup on. All right. Here we go. Let's go ahead and lay you on your back with your butt right there. Head up this way, please, sir. Now, this is the very first time you've had your spine decompressed manually, isn't it?
Yes, sir.
Okay. This being Juan's first time, he's gonna be our ring dinger of the day. Just breathe shallow through your nose. It's our weight reduction program too. We just squeeze it out of it.
Oh, no.
Keep breathing. Now you had pretty low reflexes a while ago when I checked your reflexes, and they still pretty low. We'll see if after your adjustment they improve. There we go. That doesn't mean he's paralyzed or dead, by the way. There you go. Yes, sir. I know you felt that one all the way down. Didn't you? Keep breathing. Yeah, you can hate me now or later. Looky there, though. Here, relax. Look there. Did you see the difference?
Better.
Better. Yep. He's not thinking that yet, but he will. There you go. Okay, now let me have your neck here, Juan. Tilt left. There you go. Tilt right. That's it. You got enough torture for the day?
Yes, sir. Oh, you got me there.
Yeah, I did get you.
Keep breathing.
I got you good though.
Yes, sir.
Here, let me help you up sideways.
Wait.
Bring your legs over this way. There we go. Yeah. You'll feel better when it quits hurting.
Thank you.
Sit right here for me.
Just keep breathing.
It really will feel
I
better when
was
it quits
nice
hurting.
thinking that one.
Yeah. Okay, come back this way. No, you can't sit down. Come back this way. There you go. All right, now just relax your arms for me, and I want you to close your eyes again and bend your head forward and backwards again, please, Juan. And back to neutral. See, his range of motion's already improved, and so is his biomechanics, but he's still a little forward to the right. So look in the mirror, Juan. You're standing up straighter, and you got better spacing down here, but your head's still a little forward and over to the right. So here's your homework. Pull these up and back. Flare these guys back here. Here. Now, look in the mirror. Translate your neck to the left, and then now look back at the wall behind you. Okay. I'm going to adjust your atlas on the x-axis here, sending proprioceptive, mechanical, afferent nerve impulses into your cerebellum that will help retrain your body how to hold in this position. You can relax now. Okay, now this time when you flex your head forward and backwards, you tell me if this feels any different to you than the previous one.
I can do it way forward and way backwards.
Does it feel smoother?
Yes, sir.
Imagine that. Take a look in the mirror right now. You compared to when you walked in the door. You see the difference?
Yes. I feel the difference.
Yeah. Yeah. Not only can you feel the difference, you can visibly see the difference in the mirror too. So you have what 99.9% of all our patients have, including myself, forward head posture. So try not to hold your hands out in front of you. Put your hands in your pockets. Try to keep them behind you. Squeeze your shoulders back together. Then bring your head up and over them and look backwards at the wall. That's your homework.
Okay.
15 repetitions 3 times a day. That's 45 times a day. And this is going to be sore over the next 72 hours, so expect that.
Okay.
Put crushed ice in a little Ziploc freezer baggie right on the part that's sorest. for 20 minutes. You do that every hour if you need to.
So you said pull back, left and back.
Yeah, but you gotta look in the mirror because you're tilting your head. I want you to translate that like that and then go back. Yes, sir. Yep. So you always want to look in the mirror when you first start doing this. And I do it up next to your bed at first in case you fall over backwards. You land on your bed, not your head.
Thank you.
So, would you mind sharing with our crack addicts around the world how your very first experience here was at Advanced Chiropractic Relief?
I was not expecting it. If they would have told me, I would have thought about it twice. But it feels so good. It feels good, and it helps. It helps a lot. I mean, from the way I came in to the way I'm coming out. it helps
Better.
a lot. Yes, sir.
Better. We like everybody leaving here better.
Yes, sir.
Good man. Well, thanks for sharing your experience with everyone.
Thank you so
Juan.
much.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.